Hello and welcome to our channel. Today, we have an exciting and educational video for all the aspiring nurses, nursing students, and healthcare enthusiasts out there. Whether you're preparing for a nursing exam or simply looking to test your knowledge in fundamental nursing concepts, you're in the right place. Now, without further ado, let's begin with these tough multiple-choice questions related to fundamental nursing, along with their answers and rationales. Let's test your nursing knowledge and elevate your skills together. Question 1. Which nursing action is essential when caring for a patient with a nasogastric tube? A. Checking tube placement by aspirating stomach contents. B. Using a catheter to clean the tube daily. C. Administering medications directly into the tube without dilution. D. Elevating the head of the bed to 30 degrees during feeding. Answer. A. Checking tube placement by aspirating stomach contents. Rationale. Checking the tube placement by aspirating stomach contents helps ensure that the tube is correctly positioned in the stomach, reducing the risk of aspiration. Question 2. When assessing a patient's vital signs, which factor should the nurse consider as the most essential? A. Pain level. B. Medication history. C. Family presence. D. Respiratory rate. Answer. D. Respiratory rate. Rationale. Respiratory rate is crucial because it reflects the patient's ability to maintain adequate oxygenation and ventilation. Question 3. Which nursing intervention is most appropriate when caring for a patient with a suspected latex allergy? A. Providing the patient with a latex-free environment. B. Administering an antihistamine as a preventive measure. C. Encouraging the use of latex gloves for protection. D. Monitoring vital signs every 4 hours. Answer. A. Providing the patient with a latex-free environment. Rationale. The most effective way to prevent a latex allergy reaction is to eliminate exposure to latex-containing products. Question 4. A patient with congestive heart failure complains of difficulty breathing. Which nursing action takes priority? A. Offering a breathing exercise pamphlet. B. Administering a diuretic medication. C. Administering oxygen therapy. D. Providing a blanket for warmth. Answer. C. Administering oxygen therapy. Rationale. In a patient with congestive heart failure experiencing difficulty breathing, administering oxygen therapy is a priority to improve oxygenation. Question 5. When assessing a patient's neurological status, which finding should concern the nurse the most? A. Slurred speech. B. Bradycardia. C. Pale skin. D. Decreased appetite. Answer. A. Slurred speech. Rationale. Slurred speech can be indicative of a neurological issue, such as a stroke or neurological injury, and requires immediate attention. Question 6. When preparing to administer an intravenous medication, the nurse should: A. Use a smaller gauge needle to minimize pain. B. Administer the medication quickly to avoid patient discomfort. C. Verify the medication, dose, and compatibility with the solution. D. Administer the medication via bolus injection. Answer. C. Verify the medication, dose, and compatibility with the solution. Rationale. Patient safety is paramount when administering medications. Verifying the medication, dose, and compatibility with the solution is crucial to prevent medication errors. Question 7. Which principle of aseptic technique should the nurse follow when changing a wound dressing? A. Wear sterile gloves throughout the entire procedure. B. Use a sterile dressing on the clean wound. C. Clean the wound from the center outward. D. Apply antibiotic ointment liberally to the wound. Answer. B. Use a sterile dressing on the clean wound. Rationale. Aseptic technique involves using sterile equipment and supplies to prevent contamination of a wound. The dressing itself should be sterile. Question 8. When educating a patient about the importance of hand hygiene, the nurse should emphasize that proper handwashing should take at least A. 5 seconds. B. 15 seconds. C. 30 seconds. D. 60 seconds. Answer. C. 30 seconds. Rationale. Proper handwashing should take at least 30 seconds to effectively remove dirt, germs, and pathogens from the hands. Question 9. What is the primary purpose of the Braden scale in nursing care? A. To assess a patient's level of consciousness. B. To measure a patient's pain level. C. To evaluate a patient's risk for pressure ulcers. D. To assess a patient's nutritional status. Answer. C. To evaluate a patient's risk for pressure ulcers. Rationale. The Braden scale is used to assess a patient's risk for developing pressure ulcers based on various factors. Question 10. A patient with diabetes is prescribed insulin injections. Which site should the nurse avoid for insulin administration? A. Abdomen. B. Thigh. C. Upper arm. D. Buttock. Answer. D. Buttock. Rationale. The buttock is not a recommended site for insulin administration due to variable absorption rates and the potential for muscle tissue injury. Question 11. During the physical assessment of an adult patient, the nurse observes the presence of petechiae on the patient's skin. What should the nurse do next? A. Document the finding and continue the assessment. B. Perform a capillary refill test on the petechiae. C. Apply pressure to the petechiae to assess for blanching. D. Immediately notify the healthcare provider. Answer. D. Immediately notify the healthcare provider. Rationale. Petechiae may indicate a bleeding disorder or other serious medical condition and should be reported to the healthcare provider promptly. Question 12. A patient with a chest tube experiences a sudden cessation of drainage. What action should the nurse take first? A. Notify the healthcare provider. B. Increase the suction pressure. C. Clamp the chest tube. D. Milk the tubing toward the collection device. Answer. A. Notify the healthcare provider. Rationale. A sudden cessation of drainage from a chest tube could indicate a blockage or complication, and it is essential to notify the healthcare provider for further evaluation. Question 13. A patient is receiving enteral tube feeding. What should the nurse prioritize during the administration of the feeding? A. Keeping the head of the bed elevated at 30 degrees. B. Administering the feeding at room temperature. C. Changing the feeding bag and tubing every 24 hours. D. Administering the feeding as quickly as possible. Answer. A. Keeping the head of the bed elevated at 30 degrees. Rationale. Keeping the head of the bed elevated helps prevent aspiration during enteral tube feeding by promoting proper flow and digestion. Question 14. A patient with a history of falls is at risk for injury. What nursing intervention is most appropriate to reduce the risk of falls? A. Administering sedative medications at bedtime. B. Placing the patient in restraints during sleep. C. Providing a clear path to the bathroom. D. Encouraging the patient to ambulate independently. Answer. C. Providing a clear path to the bathroom. Rationale. Providing a clear and unobstructed path to the bathroom helps reduce the risk of falls in patients at risk for injury. Question 15. When assessing a patient's pain, which pain assessment tool is most appropriate for a nonverbal patient, such as an infant or a patient with advanced dementia? A. Numeric Rating Scale, NRS. B. Visual Analog Scale, VAS. C. Wong-Baker Faces Pain Rating Scale. D. Behavioral Pain Scale, BPS. Answer. D. Behavioral Pain Scale, BPS. Rationale. The Behavioral Pain Scale is designed for nonverbal patients and assesses pain based on observable behaviors and physiological signs. Question 16. A patient with a history of deep vein thrombosis, DVT, is at risk for pulmonary embolism, PE. Which nursing intervention is essential for preventing PE? A. Administering anticoagulant medications as prescribed. B. Encouraging the patient to ambulate frequently. C. Applying cold compresses to the affected leg. D. Restricting fluid intake. Answer. A. Administering anticoagulant medications as prescribed. Rationale. Anticoagulant medications are prescribed to prevent the formation of new clots and reduce the risk of pulmonary embolism in patients with a history of DVT. Question 17. When performing nasotracheal suctioning on a patient, the nurse should ensure that the suction pressure is A. As high as possible to remove secretions effectively. B. Set to 100 mm of mercury to prevent tissue damage. C. Adjusted based on the patient's tolerance and need. D. Set at a constant 80 mm of mercury for consistency. Answer. C. Adjusted based on the patient's tolerance and need. Rationale. Suction pressure should be adjusted to the patient's tolerance and need to minimize the risk of tissue damage and discomfort during nasotracheal suctioning. Question 18. A postoperative patient is at risk for developing atelectasis. Which nursing intervention is most effective in preventing this complication? A. Administering pain medication as needed. B. Encouraging the patient to perform deep breathing exercises and use an incentive spirometer. C. Restricting fluid intake to reduce pulmonary congestion. D. Keeping the patient in a supine position at all times. Answer. B. Encouraging the patient to perform deep breathing exercises and use an incentive spirometer. Rationale. Deep breathing exercises and incentive spirometry help prevent atelectasis by improving lung expansion and reducing the risk of postoperative respiratory complications. Question 19. A patient with a history of heart failure is prescribed a low-sodium diet. Which food item should the nurse advise the patient to limit the most? A. Fresh fruits. B. Lean meats. C. Canned soups. D. Whole grain bread. Answer. C. Canned soups. Rationale. Canned soups often contain high levels of sodium, which can exacerbate heart failure symptoms. Advising the patient to limit canned soups helps reduce sodium intake. Question 20. A patient with a central venous catheter, CVC, develops signs of catheter-related bloodstream infection, CRBSI. What is the most appropriate initial nursing action? A. Administer prophylactic antibiotics immediately. B. Remove the CVC and culture the tip. C. Flush the CVC with normal saline. D. Apply a sterile dressing over the CVC site. Answer. B. Remove the CVC and culture the tip. Rationale. In the presence of signs of CRBSI, the immediate priority is to remove the potentially infected CVC for culture and sensitivity testing to identify the causative microorganisms and guide treatment.